Hi there, I'm Dr. Smee. I'm here today to show you how to do a feeding tube demonstration. We have Kalia here as our helper today for this. And this is our patient. She just had this feeding tube placed yesterday. So here we have on a collar as well. So depending on your vet, if your vet places this, sometimes they put these collars on or sometimes they'll use a bandage. We like these because they help hold the tube out of the way really nice. So at home, things you'll want to keep an eye on. So you can see in here, this is where the tube goes into the side of the neck. So at home, you want to keep an eye on that and make sure you don't see any discharge or swelling or anything. It's really important. Sometimes they can get infected, so you want to keep an eye on that at home. And then for our actual feeding, we've already prepared some things here. So this is the food that we've mixed up in a blender. Your vet should give you the food type and the amount of water that you need to add to get it to a consistency where you should be able to pull it up easily in a syringe. And then we also have here some water that we're going to use to flush the tube. You'll notice there are a couple different types of ends on the syringes. Depending on your tube type, you might need one or both of these types of syringes, but hopefully your vet will have that information for you, so that'll be pretty easy. So when we get ready to do the feeding, I like to have a little towel just because that makes it a little easier in case there's any food that spills. And if you have a helper, that's great. This part on this tube actually can just unhook here. So that just gives you a little more space with this end of the tube. So in this end of the syringe here, this attaches to this here like this. So first, we're always going to flush with a little bit of water. Whenever you're flushing the tube, it should flush easily without any resistance. So that went really nice and easy. So when we're ready to actually give the food, this tube has two different ends on it. So the end for this part of the tube that's going to fit in here is this here. So this slides in this way. Our patient's checking us out here. So once you're ready to actually give the feeding, again, your doctor should tell you how much food you should be giving. So sometimes this connection can be a little loose, so I usually hold a hand here as I push. So once you give the food, you can see it going through the tube and down in. So this type of tube is an esophageal feeding tube or an E-tube. That means the end of the tube is in the esophagus, not in the stomach. So we usually give the feedings over about 15 to 20 minutes. So if you have a pet, usually if they're pretty relaxed, you can kind of stay with them during that time and give the food over that period of time. If you have to stop, you can always unhook the syringe, hook it back up and come back to it. But I would make sure you come back to it pretty quick because you don't want to leave the food in the tube for very long. So we would just give a few little mLs every few minutes, and things to watch for while you're giving this is if your pet is acting nauseous, starts salivating, hard swallowing, or seems like they're uncomfortable, then I would stop and I would flush the tube and I would come back to it in a little bit. And then if they actually throw up, then I would hold the rest of that feeding. And if that's happening pretty regularly, I would contact your veterinarian and find out what they recommend for you. If you feel resistance when you're pushing on the tube, sometimes that happens as the syringes get a little bit older. So sometimes the syringe just gets a little stuck and you just need to work with that a little bit. The other thing that can sometimes happen after you've made your food and it's been in the fridge, especially if it's been in the fridge for a few days, sometimes it just gets a little sticky and you might have to add a little more water to be able to get it to go through the tube easily. So since we're doing this for a demonstration, we're just going to show you a little bit here. Then we're going to switch back to the water, which is how you'll end your feeding. And again, your vet should give you recommendations on the amounts of water and food and things. So when you go from food to water, you should feel a little more resistance, and then you should feel the resistance kind of give just like that. It got a lot easier. That's how you know you've cleared out the tube. So then we'll unhook that, and then she's done with her feeding. So then this will hook here again like this, and then she's all set till the next one. So a few other just little helpful things. Usually what I do is I mix up one batch of food and I leave it in the refrigerator. And then when you're ready to pull up the food, when it's cold in the refrigerator, sometimes it's uncomfortable, but you also have to be careful because it can't be too hot because that can burn the esophagus. So what you want to do when you're ready to give the feeding, if the food has been in the refrigerator, is you can pull it up in the syringe and you can actually leave it in these casings that they come with. And if you have a little bath with warm water in it, that will help to bring the food to room temperature. And this will avoid heating the food too much, which could cause burns and be dangerous to the esophagus. And the other thing that sometimes happens if the tube gets clogged or something is stuck in there, some helpful things you can try at home. You can try flushing a little more aggressively with water, with just some tap water. You can also try using a little bit of Coca-Cola or pineapple juice. Sometimes that helps to break up a clog. And if you're still having issues, you should contact your veterinarian and have them help you have a look at it and see what they can do. So I think that's everything. Thank you for watching.